You brush, you floss, you rinse. You may even chew gum after every meal, and yet your breath still isn't fresh. Sound familiar? Here's the truth. If your breath smells and your dentist says your teeth and gums look fine, the problem really might not be in your mouth at all. I'm Dr. Fatima Robertson, a board-certified periodontist right here in the Dallas-Fort Worth area. And today we're talking about bad breath that's not caused by your teeth, because sometimes even perfect oral hygiene just isn't enough. Now let's clear something up. Bad breath or halitosis simply means there's odor coming from somewhere in your body. Most people assume it's from their mouth, but that's only part of the story. There are actually a few non-dental causes that I see all the time in my patients, and understanding them can help you finally get to the root of the problem. So let's actually start with the big one, your sinuses and your tonsils. If you've ever had postnasal drip, that feeling of mucus that's trickling down the back of the throat, you already know it can leave a funky taste or a funky smell. And that's because the mucus isn't just water, it's full of bacteria and proteins. When it sits there, it starts to break down, it releases sulfur gases, which has an unpleasant smell. Now let's talk about tonsil stones. Those little white stones or yellow bits that get stuck in the back of your throat, well, they're like tiny pebbles that are made up of like old food particles and dead cells and bacteria that calcify over a period of time. So when they dislodge or get squeezed out, whew, that can pack a punch. So here's a way to picture it. Imagine there's a small sponge that's been sitting at the bottom of your sink for a few weeks. It looks harmless, but it's soaked up everything. And the minute you squeeze it, the smell tells the entire story. That's what tonsil stones are doing. They're quietly holding on to odor until they're disturbed. So if your breath smells, even though your teeth are spotless, check in with your ear, nose, and throat doctor. It might be coming from your throat, not your gums. Another big reason for chronic bad breath is having a dry mouth, or what we call xerostomia. Your saliva is like your mouth's built-in cleaning system. So it washes away bacteria, it washes away food debris, and it neutralizes the acid that's in your mouth. Without enough of it, bacteria multiply like crazy, especially the ones that produce that rotten egg smell. Dry mouth can happen for a few reasons though. So maybe you're taking certain medications like antihistamines for allergies or antidepressants or even blood pressure medications. Or maybe you sleep with your mouth open. Even dehydration can dry things out. So here's a great analogy. Think about it like a fish tank. When that filter is running, the water stays clear and clean. But if the filter shuts off even for a little while, that water gets cloudy really fast and the smell shows up almost immediately. Well, your saliva is like that filter. When it slows down, odor-causing bacteria simply take over. So if you wake up with that dry, sticky feeling or a sour taste in your mouth, that's your body's way of saying, hey, I need some more moisture. Now next up, your stomach. If you've ever had heartburn or acid reflux, you already know how uncomfortable that feeling can be. But what many people don't realize is that acid reflux can also affect your breath. When stomach acid or partially digested food creeps up into your esophagus, it can carry a sour or sometimes metallic smell. It's almost like when you open a container of leftovers that sat out too long. The odor that hits you is from the gases that are being released during the breakdown process of the food. That's what reflux does inside your body. It brings all those acidic gases right up near your throat and your mouth. There's also a bacteria called H. pylori that live in the stomach. And it's linked to both ulcers and bad breath. So if your dentist says your mouth looks great, but you still have a sour, vinegary kind of smell when you talk, it might be time to see your physician or your gastroenterologist. Now let's talk about something that most people overlook, your overall health. Certain medications can change your saliva flow or the chemistry of your saliva. Blood pressure meds, allergy meds, antidepressant meds, they can all make your mouth drier. And in some cases, your body chemistry itself can affect your breath. For example, people with uncontrolled diabetes sometimes have a fruity or sweet smell to their breath. It's caused by ketones, chemicals that your body releases when it can't use sugar properly. Patients with kidney disease may also have a fishy or pneumonia-like smell because their bodies are trying to eliminate waste through their breath. And people with liver problems can also have a musty or a sulfur smell. It's not just odor, it's your body sending up a red flag, saying something's off. Your breath can literally be a diagnostic clue for what's happening inside. So here's how I like to explain it. Your mouth is like the body's microphone. If something is out of tune elsewhere, your body is how it broadcasts the message. So what should you do if your breath still isn't fresh, even though your dentist says your teeth and your gums are completely healthy? Start by having your dentist or your periodontist rule out causes for gum disease or infection. If everything looks good, then they can refer you to the right specialist, maybe an ENT for sinus issues, or maybe a GI doctor if reflux is suspected. It's not about guessing, it's about working together to find the root cause. Because masking the smell with mouthwash only hides the symptom, not the source. So bad breath is your body's way of asking for attention, whether it's your gums, your sinuses, your stomach, or even something else. So if you've been struggling with it and you can't figure out why, don't ignore it. It's not about embarrassment, it's about information. If you're in the Dallas-Fort Worth area, schedule a gum health consultation with me, Dr. Fatima Robertson. We'll make sure your mouth isn't part of the problem and help you figure out what it is. Because fresh breath starts with understanding where it comes from and knowing how to fix it for good.